In fact, that was the call of the Prime Minister, the Jan Andolan for COVID. There's nothing that replaces the public engagement. Just multiply what I said in terms of key public health actions into that. And so that is something the government of India has to be very, very proud of. For over 3 months now, cases have been consistently going down. And I go back to that same principle of consistent public health measures and responses being implemented, whether they are for contact tracing and surveillance, the access, affordability, and the speed at which you get the result of tests, communicating and engaging with the community to be able to do COVID appropriate behaviors. In fact, that was the call of the Prime Minister, the Jan Andolan for COVID. There's nothing that replaces the public engagement and a wide population engagement in any epidemic or pandemic. It's not just in the hands of healthcare workers or researchers or experts. The collaboration with different sectors. As you know, it is a whole of government, whole of society approach. And keeping that consistently, we are now 1 year into this. And the results are seen with the cases dropping. Considering the magnitude of the population, 1.3 billion, 37 states and union territories, 770 districts, just multiply what I said in terms of key public health actions into that. And so that is something the government of India has to be very, very proud of. Bringing that diligence, discipline, and vigor into the response to a vaccination campaign. So that's another area of response. And we see that it's been so successful. Around 6 million vaccinated in 22 days. It's the fastest as we see the rates of vaccination happening. I would never say outright that viruses go out. We have already seen that they are also smart and they develop and mutate and they have variants and they manage to adapt like human beings. But we should be able to live with the virus, managing these risks, knowing what we know about Covid-19 or SARS-CoV-2 as the virus, and knowing that some key basic interventions that all of us as normal people can do, I call it the 3 W's. 3 W's is wear a mask, wash your hands often, and watch out for your distance, especially in crowds.